Welcome everyone, it's Cassie speaking from NETA here. Welcome to our webinar on an introduction to Prota and HPOS for digital health. I'm delighted to have with me today Renee Rose from the Department of Human Services. She's going to run through an introduction to Prota and some of the functionality that you can do in HPOS for digital health. Just wanted to say too, thank you very much Renee for coming and doing this webinar with us. It's something that I know has been of interest to a lot of people who've been using the My Health record system and the HI service. So really appreciate your time today to give us this run through. And just wanted to pull up a poll right now and just sort of see and gauge where everybody is with HPOS and how often you have used HPOS for digital health purposes, just to give us an idea so that Renee can tailor her webinar towards it. Okay, so we've got some people who've never used it, which is great. This is going to be a great webinar for you guys to give you that introduction, and some of you who are quite well known to HPOS. So I think the great thing is we've got a really good new service, which is Prota, and this is an opportunity for Renee to really showcase you the benefits of that. So handing over to Renee now. Thank you very much, Renee.
Hello, as Cassie said, my name's Renee and I'm from the Department of Human Services, and what I'm going to be doing today is taking you through an overview of Provider Digital Access, or PRODA as it's most commonly known. So PRODA is an alternative to the Medicare PKI individual certificates, which any of you who have used HPOS before, and there seem to be quite a few of you, would be familiar with. So they're those tokens or USBs that you plug into your machine, download the software, and use that to securely access HPOS or any other government online services. So what we've done is we've, in response to user feedback with how problematic those PKI certificates are to use, we've responded to that feedback and we've developed a new way to access HPOS, which, as I mentioned before, is Prota. So this means you can access HPOS with a username, a password and a verification code each time you log in. So very similar to, say, online banking, MyGov, if you've used that before, a really similar user experience. What it also means is that you can now access HPOS from any computer or tablet that's connected to the internet. So previously, there's, as you know, there's nowhere to put a USB into most tablets. So it's much easier to log on and access those digital health services from any platform or computer. The registration process is entirely online, and it's completed in 3 parts. Generally, you'll be online and using HPOS within half an hour of beginning your registration, providing you've got all of the information you need in front of you. The first step in the registration process is an account creation process where you actually set up your username and password. The second step is you verify your identity online using our online verification service, using government issued identity documents such as your driver's license, Medicare card and passport, and you use 3 documents to verify your identity. And the third part is you link to what we call the community that you're going to be accessing. So in our case, you're linking to the healthcare professional community. So you can use your Prota account to access HPOS as soon as your account has been set up. As I mentioned before, you don't need to wait for tokens or USBs to be mailed to you and then go and download software, etc. It's a once-only registration process, and as I mentioned before, it is completed online. So what I'm going to do today is take you through the registration process, take you through all the screens that you will encounter as part of your process, just get you familiar with these, show you, what information you need to enter, and then show you how you can then use your newly created log-on to access HPOS. And then, as Cassie mentioned, we'll have a really brief look at some of the digital health services that you can use through HPOS, which may make your life a whole lot easier if you're not already using those. So what we've got here is this is our basically our home screen for provider digital access. This screen is, you can access this through the DHS website, and we'll pop a link up there for you so you know where to access that. So on the left-hand side here, this is a log on if you've already created your account. What we're going to do is we're going to select the Register Now button on the bottom right-hand side and go through and create a new account. I know this is a bit small. It's just to give you an idea of what the page looks like. What we've got here is an overview of what you need to know before you create your account. So just giving you some information about the process, the documents that you can use. So as I mentioned before, we recommend a Medicare card, driver's license and passport, but there is a complete range of documents that you can use in order to verify your identity. And I'll take you through that more shortly. And then before you can continue, you just need to select the Terms and Conditions tick box down the bottom of the page before you can continue. I've just had a question come up saying if you've been registered with HPOS, do you need to re-register for PRODA? Yes, so you'd be registered with a PKI certificate. If you want to use PRODA instead of your PKI certificate, you need to go through this registration process to do that. The PRODA account is an alternative to your PKI certificate, so if you can continue to use your PKI certificates, or you can go through and register for a PRODA account. Okay, so what we've got here is this is that first step in the account creation process that I mentioned before. So this is where you create your username and set your password and some security questions which will be associated with your account. So in the username box, you just need to select a unique username, that's something that you'll remember that hasn't been used before. So for example, you can use like a combination of your name with maybe a number after if you need that number to make it a unique username. You just can't use any special characters. So you can't use an @ symbol, for example, which means that you can't use your email address as your username. The other thing we've got here is a password which you need to set up. So there's a strength indicator on the right-hand side there for your password, and it's just giving you some guidance that it needs to be 10 or more characters. We've got, the system will not allow you to continue if you don't have a password of sufficient strength. So it's a really intuitive experience for you. What we've got down the bottom is some security questions which will be associated with your account. These are exactly the same security questions as MyGov uses, so they would be familiar to you if you've been through that process. Things like, what was the model of my first car, what was my first pet's name, etc. And those questions can then be used if you need to reset any of your information. If you forget your username or password, you can self-manage your account and recover that information without needing to call a service officer or call a technical help desk, etc. So what we've got done here is I have just popped in a Prota username and a password as an example for you, and I've just brought up some of the questions that you may see just to give you a bit of an idea about what that could be. So I have a username of Prota testing. I've popped in a password. I think my password was password with a capital P, and then I had 1, 2, 3 at the end and an exclamation mark, and as you can see on the right hand side, that's achieved a password strength of moderate, which will allow me to continue. So we've just had a couple of questions come through which I might answer before we continue. At this stage, a Prota account is only an alternative for the individual certificates. It's not replacing those site certificates which you currently have in place for claiming. Longer term, it is something we're looking at, but at the moment it is just those individual certificates. We've also had a question come through with we've got some people that are using Prota accounts and some people that are using PKI accounts. and they've got delegations set up to act on behalf of other people, that can still be done. All those delegations are set up in HPOS exactly the same way as they currently are done. The only thing you'll need to do for new Prota users is just set up those delegations. I'll show you when we get a bit further where you can find the identifier you need in order to set up that delegation and associate yourself with the correct person. So what we've got here is we're actually setting up some information which will be associated with the account, and this will be matched against the identity documents which you'll use further down the process. So we've got a title which you can see is optional. We ask for a given name and family name. Any additional given names are useful to put in now if they're on any of your documents that you'll be using, as well as a gender and date of birth. And there's some privacy information on the right-hand side there. Then we move on to getting some contact information which will be associated with the account. Email address is mandatory. Mobile phone number is optional. However, as I mentioned at the beginning of the process, each time you log in, you'll get a 6-digit verification code which you'll need to enter before you can continue. If you enter a mobile number, you'll be able to receive your verification code via SMS if that's most convenient for you. And I'll show you what we'll do is enter the contact information, and on the next page you can see we've been asked to actually verify that we actually do in fact have access to that contact information, and that's eliminating spam and anything else that may happen. So once you pop in your email, I'll just go back a page, once you pop in that email address and select next and a mobile phone number if you chose to do so, you'll get an email sent to your email address which looks like this, and you can just see this activation code in the body of the email there, which you'll then go and enter. I'll just go back a couple of screens, enter into this field here and select next to continue. Now if you chose to put in a mobile phone number, you'll also, on the next screen, receive a code to your mobile phone which you'll need to enter and then select next to continue. We've just had a couple of questions come through saying the 6-digit codes are taking quite some time to come through in the email. We've actually sped up our response time on those codes, so they have been coming through more quickly in the last month. However, it is dependent on who your internet service provider is for how long those codes will take to come through. Then we've just had a question about how long you will be able to continue to use PKI certificates before you'll have to move across to Prota. At the moment, we don't have a firm timeline in place for that. However, we're anticipating that there will come a point where the department will start to phase out those individual PKI certificates because they are becoming more and more problematic to use. As well as from a usability perspective for yourselves, we've also got companies like Microsoft are starting to block the use of them because they're seeing them as threats and harmful to computers. They're seeing them because it's a plug-in that you're putting in your computer, to digress into sort of some techie speak. So our operating systems are actually starting to block those more and more, which is why we've had to come up with an alternative for those. I'll just come back to the slides. We've just got a mobile phone code which you'll enter here, and that mobile phone code looks something like this on your screen. So you'll just enter that verification code, and in the background, as soon as you've entered that information, you'll get this account created email to let you know that your account has been successfully created, which is the first step in that registration process. And it's got your username here for future reference, as well as your RA number, which you can see in bold in the text of the email here. Now this RA number is particularly important if you want to set up delegations to act on behalf of somebody else. This is the number you'll need for your Prota account in order to establish those delegations. Now, if we have if you misplace this email or file it somewhere super secure, never to be found again, you'll always be able to log in to your Prota account and find this information at a later date as well. This RA number will also be used if you need to set up your anything for PIP, for the practice incentive payment. You can contact the PIP helpline through DHS and provide them with your updated RA number so that you'll see all of the appropriate PIP information and all your PIP statements and the subscriptions through HPOS if that's something that you're currently using. Okay. So as you can see, we've just, we're coming towards the end of that first step, that account creation process. And what it's asking us now is how we would like to receive our verification code, which we will enter each time we log in into HPOS using our Prota account. So there's a drop-down menu here. You can see that there's an email option there. If I haven't provided a mobile number, I'll only have email available in that box. However, if I'd provided a mobile number, they'll both be available in that drop-down section. The other thing that there's some information here about is the Prota Code Generator app, which is available from Google Play or the App Store. And the purpose of that app, which you can download, is to generate a code for you whenever you need it. So that generates a code offline. You don't need to have your phone connected to data to get that code. And that's particularly useful if you're in a rural area where the code responsiveness may not be as good depending on who your internet service provider is or telecommunications carrier. So that's just another way you can get a code if you are having trouble with the timeliness of your code, which was a question that was raised earlier. We've got a question, if I already have an RA number and register for Prota, will I get a new one? Yes, you will. So the RA number that you've currently got is for your PKI certificate. You'll get another one for your Prota account. You'll need that new RA number to set up delegations for that. A Prota account is available for anybody, practice staff, GPs, nurses, etc. The way the Prota account works is it just allows you access to HPOS, the same way as your PKI certificate allowed you access to HPOS. Any functionality that you had access to within HPOS, whether it be for ASA, for PIP, for Ehealth, etc., depending if you're an RO or OMO, all of that you'll continue to get access to that. So Prota isn't changing your accesses to anything, it's just changing the way you access it. What you need to do is when we get further down and we're linking to our community and setting up and linking to all our identifiers, you just need to make sure you put all the correct identifiers to make sure you have the right view of HPOS. And I'll take you through that shortly. Okay, so what we're moving into is the second stage of the account registration process, where we are doing the identity verification. So the identity verification is done through an online verification process where you can enter information from your some of your government-issued identity documents, and that information is checked in real time, and your identity is securely verified online. Now, we don't hold any of your identity information. We just use the information to pass to whoever has issued your particular document. So if it's a passport you're using, that's been issued by Department of Foreign Affairs and Trade. If you're using a Medicare card to verify as one of your documents to verify your identity, that's been issued by Department of Human Services, etc. So all we're doing is checking that information you provided against the source to verify your identity, and we do that for 3 documents. I just had another question, which I think I touched on before. Someone saying, are the RA numbers the same for Prota as they are for the PKI certificate? It will be a different RA number. So basically this first slide here is just getting some information. It's providing information that you've already submitted previously, just to make sure that that information is correct. And we've got some information down the bottom of the screen about what documents you can use in order to verify your identity. Now, if you have had a change of name between your documents, so if you have you're using your birth certificate, which is in one name, and then you're using, say, a driver's license and a Medicare card, which are in a different name, you will also need to provide some form of change of name certificate, whether it be a marriage certificate or another change of name certificate, which has been issued by births, deaths and marriages in your state, in order to verify that those two people are the same. So it's just making sure that I can't use John Smith's document and George Brown's documents in order to verify your identity. We're linking those two documents together to make sure it's the same person. Now, it is important if you're using a change of name document, and I'll touch on this again shortly, that the document does have to be issued by births, deaths and marriages. A ceremonial certificate from a service, like a church service or a civil celebration, will not suffice. So at this point, we realise that everyone may not have their identity documents on them. So it's just giving you the opportunity to exit and come back later, and it will bring you back to this point in the process. You won't lose any information that you've already used before. So what we've got here is we're going into this identity verification process, and it's asking us to enter information from our first document. So as you can see, we've got quite an extensive list of documents that you can use in order to verify your identity. A question has just come about the currency of a passport. It needs to be, it's the same rules as DFAT issue for passports, so it has to be within 2 years of expiry to be used by the system, because we're actually checking your passport against the DFAT systems. So what we've got here is we've got the first document that we'll use is a Medicare card. So as you can see, I just selected the Medicare card button at the top there, and what it's done is expanded this field to ask me to enter some information from my Medicare card. Now, I set up my identity, my account as John Smith, but for some reason, if my name is different to John Smith, so it's, I know on my Medicare card, I have a middle initial displayed on my card, so you would select this third button down the bottom to say your name is different to John Smith, to say John C. Smith, just to make sure that your card is an exact match to your document, because that's what it's checking against. We also know that with some Medicare cards, names are split across different rows, so you have the opportunity to make sure that you can match your information exactly. Then what we ask for is you to enter your Medicare card number, your individual reference number, your card colour and your expiry date, and select Next in order to continue. Now what will happen is in real time, that document is verified against the issuing system, which is Department of Human Services in this case, and within a few seconds you can see that a successful message has come back on the next screen saying your Medicare card has passed the online document verification. Now, it's asking us to move on to the second document, which in this case, we are going to use a driver's license. So if I select that button, it expands that field, and we've got the option again, if your name is different on your driver's license, you can enter it exactly as it appears on your driver's license by selecting that checkbox there. Otherwise, enter your license number and your state of issue, and then you can select Next in order to continue, and that document will be verified in real time. And as you can see, the driver's license has passed the online document verification, and we're going on to the third. Now you may have noticed each time I've used one of these documents, it's been removed from the list to make sure that we only use a document once. The third document I'm going to use is my passport. Now, the reason we recommend driver's license, Medicare card and passport is that they have the highest success rate of passing online, and they have the least number of fields that you need to navigate in order to use it. That's not to say you can't use any of the other documents, and we do have guides, user guides available on our website with more information about how to find the required information on your particular documents. Now, I'll show you the passport, and then I'll take you through if you don't have 3 of these documents. If you open this passport box, you can just see that you pop in your document number and select next to continue. As you can see, passport is probably the easiest document to use online. Now, I realise that not everybody has these documents available to them. There is an option down the bottom here, and you can see with my cursor here, I've got this option down the bottom. I don't have any of these documents. Now, if that's the case and you don't have any of those, we do have a manual form that you can complete and return along with photocopies of your documents, and we will do that. The only thing to note is that it won't be processed in real time. You will have to wait for that to be processed, and then you'll be notified when your account has been finalised. So if you don't have like a passport and you don't have an Australian birth certificate, if you've from overseas, for example, we do accept foreign passports with your Australian visa, which will be embedded into your passport, but we do realise that there's some people who won't have the documents, which is why we have an extended list of documents which you can use on our form. So the extended list includes things like bank cards, other proof of age cards, things like maritime safety cards, other documents which have been issued, and that is available. Once you select that I don't have any of these documents, a form will pop up for you to download. Now, on this next screen, it's letting me know that my account has been successfully verified, and my Medicare card, driver's license and passport have all passed, and I can continue. What I am going to show you on the next screen is, as I mentioned before, if I've had a change of name between any of my documents. You can see we've got Barbara Huxtable has be on some documents, and we've changed to Barney Huxtable. We just ask you to select a change of name document from this list, which looks something like this. You can see from this next screen, and you've just got to enter the state or territory it was issued, year, registration number, date of issue, etc., a certificate number, and what your name has changed from and to, and that will be checked against the births, deaths and marriages in your state who hold that document. So as you can see, there are workarounds available for that. And you can see from this screen we've successfully passed our change of name certificate as that fourth, only if required. If all 3 of your documents are in the same name, you won't need to provide a change of name document. Now we're entering into the third and final stage of the account creation process, which is linking to a community. Now in this case, most people on the line will be connecting to the healthcare provider and administrator community. The next screen that comes up is to ask for any identifiers you may have as part of your role, and what this does is by linking your identifiers, which are things like your RO number, your OMO number, your provider number, your any of those ASA, nursing numbers, DVA numbers, etc., any number you have that's issued by the Department of Human Services, we've got a list of, say, 15 we accept. You can link at this stage, and then when you access HPOS, that will mean you have access to the right services when you go in. So I would say that yes, I have been issued with identifiers as part of my role, and then it brings up this next screen where I can select from this drop-down menu what identifiers I want to link. If I have an APRA registration number, as you can see at the top of the screen there, I can link that, and that will bring back all of the identifiers that are linked to that number. So it'll bring back all my provider numbers that are linked in our systems, etc. Now you can link provider numbers, DVA numbers, APRA numbers, HECS reimbursement scheme identifiers, HPIIs, HPIOs, RO, OMO, medication review identifiers, PBS approved prescriber identifiers, etc. So just highlighting that there are a number of things that you can link to that. Now, as you can see on this next screen, I've chosen to search by my APRA registration number, and when I put in that registration number, it's also brought back my prescriber number, my provider numbers, based on the locations I work at, and my ASA identifiers. So you can see it's just important to link all of these identifiers so that you've got the right accesses when you get into HPOS. Now, we know that for some reason you may have an identifier that's not linking for some particular reason, just so you don't need to then go and fill out a form because your identifier is not working when you've got through, you know, all the difficult parts of the process. We've got an opportunity here for you to pop in what you expect your identifier was, and you can request help from a service officer, and one of our service officers will look into this and find out why your identifier wasn't linking properly. It could be as simple as a date of birth mismatch. It could be a transcription issue. You've got slightly the wrong number to what we've got recorded. There's a variety of different reasons why they may not match. So it could be as simple as your provider number has been issued in your maiden name and all of your other documents are in your married name, and it's a mismatch. So we can look into that and resolve that from our end, and that's generally done within a couple of days, providing that it's straightforward. So as you can see, we've got a complete list of all of the identifiers that have been linked to this PRODA account, and one that wasn't able to be linked successfully, and that will be investigated. So all of the others will be linked and work correctly. It's just that last one, for whatever reason, didn't work, and we can look into that from our side. Now, we've had quite a few questions come up about delegations and how people can delegate. Delegations will continue to happen exactly as they already are. So delegations are set up in HPOS, not PRODA, as they have been done. So what you'll do is you'll go back I'll show you how to get back into your account. Go into HPOS, which we'll do now, and then you can go to your menu and link your delegations exactly as you've done it previously. If you do need help with setting up delegations, we do have user guidance available on our website to step you through that. Now, as you can see, we've linked to the healthcare provider and administrator community, and I've got an option here to go to my services on the right-hand side that's been circled. Now, when I selected that, that's brought up all of the services that I've got available in that community at the moment, just HPOS. And I can go into that. If I select this menu up the top, that will allow me to manage my Prota account. So I can go into that, I can view my RA number, I can update my password, I can add more identifiers if I've forgotten some before or didn't have them on me. I can change any of my name information, anything I've done in this registration process, I can update by accessing this menu, which is available on the top left-hand side and circled. But if I'm happy with all of the information, I can just select this Healthcare Professional Online Services tab, and this will take you through to a screen that you're quite familiar with, which is the HPOS the HPOS page. So the view we've got here is a provider view, which is why we've got access to claiming, reporting, MBS item checker, find a patient, etc. If you were just an administrator or a more basic, you would have a screen that looked more like this unless you go in and act on behalf of the provider, which is where you'd see a screen like this. So it's just showing the different views that you may have available to you. Now on this next screen, we've got where you can select, sorry, I was just getting my cursor. Select this menu up the top here, which you can see that I'm circling. If you select that menu, it will launch the HPOS menu, where you can go in and you can either select to manage your logon account, which is highlighted there. That will take you back into PRODA, where you can manage your account. Otherwise, you can access any of your information that you currently access in HPOS. That hasn't changed. Now what you can do is you can go into the My Details. Sorry, I'll just pop the cursor back on. Since there's been quite a few questions about delegations, you can go into this My Details tile and set up delegations through there. If you do need more help about setting up delegations, we do have information available on the DHS website about that. Now, if you selected to go back in to manage your logon account, it will take you back into Prota. So this is just a view of basically a condensed view of what you set up previously, just on one page. So you can see you've got information on the top left hand about your account, the name information. You can edit that if required, edit your contact information, cancel your account if required if you're no longer going to be using it. There's some information about the security of your account details. Of particular note in the account details section is your RA number. That's the number you'll need when you're setting up your delegations. Now, the other thing I wanted to walk through quickly is just how you can use your newly created account to log back into HPOS. So what we've got here is this is a screen that would be familiar to most of you, which is the DHS website, and this is the health professionals page on our website. Now, if you select to the log on button on the top right hand corner, it will take you to the HPOS page. Now there's now a new option here at the top to access HPOS using PRODA. There's also some other information on this page which is available here. Sorry, just pulling up my cursor, to register, services that you can use with HPOS, and other resources available to you. So if you want to access HPOS using your Prota account, you select this top option here. If you're continuing to use your PKI certificate, that's available just down below. Now I will select my Prota account, and this brings us back to the page that we saw at the beginning. Now that we're just logging in, instead of using the Register Now button, we'll be using the left-hand side. So what we'll do is pop in our username and password, and you can see some hyperlinks underneath each of those fields. If for some reason you've forgotten that information, you can recover that information through, it's a self-guided online process. You don't need to contact any service centres for any assistance there. And based on the answers to your security questions, which you set up at the beginning of the process, you will be able to recover that information or reset your password if required. Now, as soon as I've popped my username and password in and selected login, I will be sent one of these verification codes to whatever my preferred nominated option was that I nominated at the beginning. So you can see very similar to what that activation code looked like at the beginning. I've got a Prota verification code via email or SMS, or I could, if I've synced the app to my Prota account after downloading it, I could just open my app and it would generate a code for me as well. Now, the next page I'll see after I select this, I'll just go back. The next page I'll see after I select this log on button is this page here. I'll enter my verification code, which I've received, into this button here. The verification code is automatically sent. You don't need to do anything to get that. And then I'll select submit. Once I've selected submit, I'm into HPOS. I haven't had to plug in anything. I can do this from a tablet. I can even do it from an iPhone if I want to sort of squint to see what's on the screen. I can do that from anywhere, and I'm into HPOS. Now, I've had a couple more questions come through about delegations. I think I've covered most of those previously. Delegations have not changed with Prota. They are done exactly the same way as they have been done previously. There is information on our website, or you can call up the DHS Service Centre if you need any help in establishing those delegations. Prota hasn't changed that. Now, this is just showing you you're into HPOS. You can go ahead and use that exactly as you've done it previously. The important thing to note is you need to make sure you put in all of your identifiers that you have, whether they're RO, OMO, nurse, provider, etc., to make sure that you see all of the correct tiles within HPOS. Now, the only exception to that is for the PIP program. That doesn't automatically come across. You do need to contact PIP, the PIP phone number that's available on all of the PIP documentation and website, and just notify them that you've set up a Prota account and give them your RA number, and they will do that for you. Okay, so the next thing I'm going to touch on briefly is just some of the things that you can do in HPOS for the healthcare identifiers and My Health Record system. This is all things that have already been available in HPOS, but for some of you who haven't used HPOS before, this may be new to you. So for those of you who are already using these functions, that's fantastic. Continue to do so. One thing you do need to do is just to make sure that with your Prota account that it comes up and that you can view this. You just need to make sure as the RO or OMO, you've linked your OMO or RO number on that screen. Now, one useful tip, I know that not everybody knows their RO or OMO number. What you can do, and I'll just go back a few slides to show you. Apologies for the scrolling. What you can do on this slide, where you're linking your numbers, in this drop-down box, there's a HPIO option. If you select HPIO and pop in your HPIO number in that box, it will automatically bring back your OMO number for you. Now, I know that everybody who's using the digital health system generally has their HPIO number available in their practice software, so that's a really easy number for you to track down. So it's just a useful tip that I use. If you don't know your OMO number and you don't want to log in with your PKI certificate to find your OMO number, it's just a really useful way is to link your HPIO number, providing you're already an existing OMO. I'll just go back to where we were. So apologies, won't be a moment. Okay. So this screen is just to show you what your access may look like when you come into HPOS. So it's highlighting that everybody's access will be different depending on what identifiers they have linked to their Prota account. If you are acting for a doctor, you'll have, as a delegate, you may have quite an extensive view. If you're an administrator that's an OMO, you'll have one of these more basic views, etc. So it's just highlighting that everyone is different. In order to access the HI and My Health records, you need to go into the My Programs tile, wherever that happens to be for you, and that's just been circled in red there for you. Once you've gone into, and apologies, these are a bit blurry, they've been had to be expanded and blown up for use in this webinar, you'll select that Ehealth My Health Record System tile. It may still say Ehealth Record System if that hasn't been updated yet, and you'll select that tile, and that will take you through to the My Health Record functionality that's available there for you. Some of the things that you can do in that, sorry, I'm just catching up with my mouse. Some of the things that you can do here is you can do the Ehealth record organisation registration. So you can see there's just a couple of options there for you to do the healthcare organisation registration or to manage your authorisation links. You can do either of those options from this page. Now what we've got here is if you're registering a new organisation, you just select that first tile there, and that would take you through, and you can just enter whatever, and it will take you through a guided process to enter that information. Similarly, if you want to manage your authorisations, you can also do that, and that's what this information will look like. It essentially allows a healthcare provider organisation to establish a list of individual healthcare providers who are authorised to access the My Health Record system on behalf of the organisation. So just highlighting to you that this functionality is available in HPOS, and you can do that through this. Now another section that a lot of you may or may not be aware of, and I know some of you are already using this quite regularly, is that there is healthcare identifiers information and administrative functions available through HPOS. So everything you can do through HPOS is purely from an administrative focus. You can't access the My Health record through HPOS. It's just managing the organisation from an administrative perspective. Now, I should have mentioned this for the My Health record. Both the My Health record and Healthcare Identifiers tile will only be displayed if the user has completed a HI registration and has the identifiers stored in our system. So if you haven't actually gone through that process, you'll need to do that before these tiles will be available to you. Now the next thing, once we select the Healthcare Identifiers tile, we've just got some information to let you know that from this menu you can view your organisation details, you can view your network map, you can view your own information, you can search the Healthcare Provider Directory or HPD for an organisation, you can search the HPD for an individual provider, you can search the healthcare identifiers for an organisation or for an individual. So just highlighting the functionality that you can do through HPOS. And what I've done here is I've just brought up to search the HI provider directory for both an individual and an organisation, just to show you what information you'll need to provide in order to bring back that information. So you can do, for both of them, you can search via either HPII or HPIO, or if you don't have that information available, you can do a demographic search. Now, you'll only be able to view this information if the person that you're searching for has elected to have their information published in the Healthcare Provider Directory. Now another option that was available in that earlier menu there, back in this menu here is to view a network map. Now, this is particularly important if you're, say, an OMO and you're of a seed organisation and you're wanting to manage the networked organisations which are available underneath in your hierarchy. So that this is where you would manage that, do any restructures if required, view any of those HPIOs, etc. So this is just to help you out in managing your organisation. Now, another really useful function in HPOS that you can do is view some information about your organisation under the, I'll just go back to the network map to show you. So you can view your organisation details option. Sorry, I'll just scroll back down. And this is particularly useful because, as you can see here, you can view your HPIO number, you can view what your organisation has been, the name of your organisation, etc. As you can see, I'll just bring up the cursor. There's a number of options available along the top here in order to manage your organisation. You can see a summary, services, names, contact information, addresses, etc. One of the very useful things to do is to view the HPD tab. Apologies that it's a bit blurry. That's the third last tab along the top there. This allows you to publish your organisation's information in the healthcare provider directory. So just if that's something that that you want publicly available so people can search for you, etc., this is where you would go to do that. And that's mandatory for PIP as well. So if you want to be getting your PIP payments, that is perfect to come here and do that. And you can do this online without needing to call up or anything as well. Now, another useful thing in this menu is the fourth last tab from the end, where you can view the HPIIs or the individual providers that have been linked to your organisation as well. So just a really useful thing if you want to manage that as well. So that was basically what I wanted to do with these My Health record and healthcare identifiers slides, is just bring to your attention some of the features that are available in HPOS to manage your organisations. And as you would all be aware, a lot of this information you need to have listed for PIP purposes and to manage your organisation for the My Health record as well. So that brings me to the end of my slides.
Thank you, Renee. It's been a very useful information and really valuable to me, and I'm sure to all the audience. Just lastly, if there are any more questions for Renee, as I said, if we haven't covered off your question right now, we will get back to you with a series of the questions and answers in the next couple of weeks once they're all approved. But just give you some time to see if there are any more questions. And I just wanted to highlight that we've got another webinar next week around change management strategies and how you can work with your GPs and get them on board and give you some lessons learnt on some of the implementations and some of the tips that we've got, based on being out there and dealing with our GPs in the field. Doesn't seem like there are any more questions. It's last chance if anyone's got it. As I said, we will give you the questions and answers to all these in the coming weeks, and any that we haven't addressed right now, we will definitely address it at that time. Really appreciate your time and your listening skills today. Hopefully you will all register for next week's webinar. And again, I wanted to thank Renee so much for her time today. It's been invaluable. And I'll just hand over to Jeff, our Redback coordinator. Thanks, Jeff. And thank you again, everyone, for your time.
Thanks, Cassie. I'd like to remind everyone that a copy of this presentation will be sent out along with a copy of the slides. I'd like to thank Renee for her presentation today, and thank you to everyone for participating in our webinar. You'll now be redirected to a short online exit survey. We ask that you please complete the survey, as your feedback is very important to us, Nita, and of course to Renee. We thank you in advance for your feedback and wish you a pleasant afternoon.